Hi, in this video, I want to talk about muscles around the knee. Hey, welcome back. This is Elbu, your exercise physiologist. So, some people may be confused with whether the muscles belong to the knee joint. In the medical, in the allied health professional point of view, the muscles that's considered muscle around the joint is when the muscle crosses that joint. So if the muscle is near but it doesn't cross the joint, it is not considered the muscle that's around the joint. Okay, so if we look at our knee joint, all right, so for example, your knee joint, this is the front, right? This is the back, this is the side, this is the other side, right? So muscles that comes from the top and crosses the knee joint and that affects the knee's movement is considered. So we have your quadriceps group muscle, we have your hamstring group muscles, we have your adductor group muscles, and we have your adductor group muscle. There are actually two muscles that doesn't really fall under this because they kind of work by themselves. So there's two more, which is the sartorius and the gracilis. And if you look at how they come around the knee joint, they do very specific work. And you realize this group of muscles that I just spoke about, they are grouped together because they do similar function. But when you put them in different position, or you put yourself in different position, different muscles will get to work. So although we have many muscles around there, it doesn't mean that every time this group of muscle will function when you put yourself in a different position, right? So there are muscles that's also coming down from the back of your knee and going down to your heels, and those are your gastro muscles. And there's one that's hiding behind, which is your popliteus, right? So you can see that if you take a look at the anatomy, you find that all of them crosses the knee joint, and we specifically say that these are the muscles that's affecting your knee when you move. And those muscles that is nearby, so near, and it's just like a few cm away from your knee, it's not considered muscles around the knee joint because it has got nothing to do with the knee. If you track, you realize that all muscles will at least cross a joint, at least. And they usually control the movement over there, right? So they may come from a distant area from that joint, but because of how it functions, it has to be that long. And when you look at the original and you look at the attachment, the insertion, it may be long, but it is how it is, and it's there to control that specific movement. So take a look at your anatomy. I'll put a link somewhere here so you can actually look at the muscles around there, and you at least have a visual effect of it. So I hope this helps you, because a muscle that's nearby doesn't mean that it's muscle of the knee. All right, so please take care, and I'll see you soon. Bye bye.